Greetings, theists and non-theists. Reforms for universal healthcare. The key is this one is actually to learn from the mistakes of others. No system is perfect, and if they tell you, "Oh, universal healthcare is great," and deny all its flaws, they go, "Oh, you're just a right-wing hate." Now, what? Be honest. Let's not be fucking liars here. No system is perfect, okay? So the reforms I'll suggest is actually learning from the faults of others. The first one is that we need doctors to basically compete. So if they basically help their patients have, the patients have better scores. If there's some sort of scoring system or something, basically better overall health, then they should be rewarded, obviously. And that these results should also be available to the public, so that people know that they're getting a good doctor, so that they can actually have confidence in the system. And this is the fault of Canada. They don't allow their doctors to be rated at all, any sort of any sort of safe fashion, and that's bad. Of course, everybody will try to go to that really good doctor, but you'll only wait so long, of course. You'll go to the second best and the third best. But basically, the doctors who can't get patients, of course, they're shown the door. A second one is that we need to institute a system of basically clinical trials. This is in order to prevent, payment for things like acupuncture and homeopathy, and all these sort of fluke medical things that seem to be popular in the NHS in Britain. Why waste our money on something that doesn't work? Something that does work. We might as well waste our money with something that works marginally than something that doesn't basically not work at all. And as a result, they need to go through clinical trials in order to prove themselves that they at least do freaking something, and so when a person needs that freaking something to be done, then they can go ahead and get that done. Reform number 3 is basically still more incentive. I think is if somebody suggests something that will save money in the way of the system operates, and then they should ought to get a sort of bonus fraction of what they save, the suggestion that actually saves the money. And so as a result, everybody will be looking for what? Ways to make the system more efficient. Spend less money, have greater... So we have things that make greater care and make it more efficient. So that we're still getting the benefits of what the capitalistic system provides, in the sense of competition makes things better, and still get the care for everybody. A fourth suggestion is well, hopefully, if a system that actually saves money can now afford to, so if queues get certainly long, certain amounts long, then it should just be mandated. Okay, we need to expand to meet the needs. So we could get more machines in, more doctors in, more whatever we need in order to help lessen the queues. So part of the objective of this system is to lower the waiting times, especially for critical procedures. Critical procedures for whatever you need to have done. Surgery, you broke your shoulder, you need to find out where we need to fix it. All those sorts of things. And Canada right now is simply a nightmare for anything to get radiologically done. So obviously, if they're going to spend more money on their healthcare system, then obviously we know where to go, don't we? So we need a system that cues us, okay, we're having deficiencies in this area, and then we set real substantive goals in order to solve them. My fourth suggestion is that really let's just cut the bull jive about basically paid medical vacations. If you don't have an incentive to get better, to go back to work, and then you'll just basically take advantage of this system as it happens in, you know, France and Denmark, or I forget these other national systems that provide you a real vacation on the medical dollar. That doesn't make any sense. Let's not waste money on that. If you have vacation time and you need it, then take it. But let's not waste it on the medical field. Let's not waste the medical field's money. Let's let them use that money for something else, to have somebody get what they need. And that's my biggest complaint about this system, is that something like that exists. I have no problem everybody getting health care, but that sort of welfare system does not encourage people to work. And so that really stagnates everything and makes taxes basically unnecessarily heavier than there should be. Come on, let's let everybody else spend their money the way they want to. So let's cut all the fat and make it as efficient as we can. So that's basically my critique of the universal healthcare system. The things I will do if I was a dictator or whatever, that's were the things that I make it better. So, take care.